Welcome to tonight's study session of the Boulder City Council. I am Council Member Marquis, and thank you for joining us. We have only one item on tonight's agenda, which will be the homelessness strategy update scheduled for the entire meeting. Before we go into our work items, I would like to outline how the meeting will be conducted. We will review the staff's presentations, and then we will have time for questions. At the end of the presentation, we will conduct our council discussion with staff. If you have questions, please wait for staff to complete the presentation. We will now turn to our city manager, Nuria Rivera-Vandermeid, to introduce our first item and only item.
Thank you so much, Councilmember Marquis. I am so excited to come before you today to kick off this important work. And though I'll try to keep it as brief as possible because there is so much to cover today. I will say our collective efforts have already achieved significant progress, helping over 2,100 vulnerable people secure housing since 2017. Tonight, we're going to be focused on our updated Boulder homelessness strategy, which builds on a strong foundation over the past 5 years. The process to update this strategy took place over the period of 6 months, and we certainly did not do this alone. We engaged with a diverse set of stakeholders from providers, frontline staff, individuals with lived experience, and business and community leaders who provided invaluable insight in both single adult and family homelessness. And I have to say, we are so grateful for their contributions throughout this process. And while this strategy focuses on the city of Boulder, we recognize that implementation is a truly collaborative effort, and our continued regional partnerships are essential to its success. The plan calls for standardized practices, better data sharing, and an optimization of service delivery to ensure our investments are as impactful as possible. To that end, a significant part of the strategy's development was the system modeling and analysis that provided us with the insights needed to make these strategic investments. We're grateful to have Mandy Chapman-Semple of Clutch Consultant with us today, who was instrumental in this process. Clutch specializes in transforming homelessness systems across the U.S., working with cities like Denver, Dallas, Los Angeles, and Cleveland. And I'll say I had the privilege of working with Mandy when I was in Austin. Clutch has achieved significant reductions in homelessness in these communities through system transformation, strategic redesign, and implementation. Mandy and her team's guidance and expertise has provided a strong foundation for this strategic refresh, and they are here to present their finding and recommendations. But I also want to recognize Kurt Fernhaber and the Housing and Human Services team at the city. Their efforts and their leadership have been incredibly important over the past few years, both in achieving significant outcomes and diving into this new strategy. They have been and they continue to be invaluable. And so first, I'd like to pass it to Kurt before we hear from Mandy. Kurt?
Thank you, Nuria. Yes, so Kurt Fernhaber, Housing and Human Services. And we as a staff team, we've really appreciated and valued working with the Clutch consulting team and the expertise that they've brought from other larger cities and bringing some of those solutions and ideas to the city of Boulder. So tonight, and Mandy will be doing the bulk of the presentation this evening. But from the Housing and Human Services side, we have Megan Newton, Vicki Ebner, Elizabeth Crow, and Wendy Schwartz, who will help me answer some of your questions this evening. And so really look forward to this more in-depth conversation that we have occasionally on this topic in an area that the community cares a great deal about. And with that, I will hand it over to Mandy Chapman. Thank you.
Thank you. It's wonderful to be here, and I'm just pulling up the slides and getting them into presentation mode here so we can jump right in. Great. Well, thank you for having me back and for the incredible opportunity to work with your team at the city and with all of the partners throughout the Boulder community and including the County of Boulder and others who so graciously kind of leaned into this particular process. I'm excited today to be sharing with you the results of the last 6 months of activity and really going to focus today in this presentation and we hope in this session on thoroughly understanding the strategies that are being presented, the particular roadmap that's being provided. And while it can be incredibly tempting to want to dig deep into some of the system modeling and the budgeting that's included in the report, we're really aiming for this particular session to ensure that there is adequate alignment on the strategy so that staff can proceed from this point forward with this document serving as an operational roadmap for their implementation of the strategies and also for their formalization of budget requests and also alignment of resources across other partners. In no way is the strategy update today intended to imply that the city of Boulder can or should cover the entire cost of the homeless response strategy. The strategy update recognizes the incredible role that other partners play, particularly the Boulder County and other critical service providers. So with that and the focus today is really intended to organize around that strategy so that staff are well positioned to help support the alignment not just of the city's resources but of their partners resources as well around this kind of larger kind of strategic update for your community. I think it's important to recognize that this strategy really built on the 2017 strategy document that was presented or that was created by the city of Boulder. The key distinction here, I think, at the time when that 2017 strategy document was brought together, there were a different set of conditions. It was the first time the community was really coalescing in a really organized and coordinated way. And it represented a wide swath of strategies that helped this community move in a very kind of specific and strategic way, learning lessons, building upon its learnings over the last 7 years. And so we really wanted to honor that work, not necessarily stray from it, but bring a larger systems-based approach to that thinking. So instead of looking at individual programming and asking, is this program kind of getting the results that we're looking for? What we needed to do is take a more holistic view and understand the interconnectedness between these programs, understand how resources are aligned or are not aligned and the impact of that, and really try to extract from this overall this holistic view, what are the most high impact solutions? There can be really excellent programming taking place, but it may not be achieving the highest impact. And so that is, how we wanted to help this community build from its 2017 strategies, honing in on those strategies that are going to have the greatest impact and the combination of strategies that were going to be required in order to produce now some very particular results. The 2017 strategy cast a very big vision, and we've maintained that vision, but this strategy document in front of you now really represents a narrowing and a focus, which provides more clear kind of opportunities to reach particular milestones over the next 5-year period. And the system modeling contained within the document serves as a roadmap and a framework for how on an annual basis you can set priorities, you can set annual action plans based on the resources that are available both within the city but also in partnership. And this is how you start to move incrementally toward the milestones that are outlined in this particular document. Nuria mentioned the incredible participation that took place from the community in order to make this document possible. I just want to reiterate that the providers in particular attended multiple work sessions, as did our county partners. And these work sessions were really instrumental in helping us explore this holistic view, looking at the system model, tweaking that model, discussing deeply the programmatic adjustments that may be required in order to implement the model, discussing the constraints and the real feasibility considerations for each of these strategies. We also were able to meet with a larger variety of community stakeholders, some within the city itself, and others within the business community, other area administrators within the behavioral health system. These were all really critical conversations that helped to shape the overall document that has been presented. The format for the document itself was really intentional to recognize that we can't have just one single set of strategies for both individuals experiencing literal homelessness and families experiencing housing instability. That, in fact, the conditions surrounding those two populations and the resources that have invested and the systems that have evolved actually look quite different. So we were able to create two distinct response plans within this single document, following the same format, each having a preamble describing the current conditions, each having a roadmap that establishes a goalpost, the milestones that this community should aim for over the next 5 years, the core strategies that will be required. Each has a system model that provides guidance for strategic investments and program priorities. Each describes how to measure success, and each provides an implementation overview. But as we get into the meat of each of these response plans, you'll see that they're actually quite distinct in what they're aiming for. And that really is because of the investments that have been made to date and the different populations that each of these are intended to support, to intervene, and to stabilize. When I was here in February, we shared that this activity would include system modeling to reveal high impact strategies. And I just want to give a little bit of a primer. While we won't go into the complete detailed results of the system modeling, all of it is contained within the document. I do want to help everyone appreciate how the system modeling was an important dimension in understanding and analyzing whether any one particular strategy that has existed in the 2017 document, whether that strategy was ultimately going to contribute to where we wanted to go next, or whether that strategy had done its job and now we needed to pivot or make adjustments. And so the way we were able to do that is using data. We were able to analyze what's the annual inflow that will exist for each population. And then with an understanding that for everyone who falls into homelessness, we want a system that can ensure that those individuals exit homelessness in a timely manner. And so that's how we started to contemplate the combination of activities that would, immediately provide relief for those experiencing the crisis, but then also equally provide a timely remedy. And so what's the balance of those investments, what exists in the community, and where are the gaps? And each of those things helped us kind of further understand as a larger community within those provider work sessions in particular, how everyone's role kind of fits within the context of this particular plan, but also where the priorities that we've had in the past have enabled us to get this far, but how a perhaps slight adjustment in those priorities going forward is going to help us get to that next larger strategic impact that everyone is looking for. And that won't be at the expense, right, of the overall system. It's about building on the system that's already been created. Within the system modeling process, we did approach it in the same way, but obviously there are differences in the particular source data that are available to us between individuals and families. And there's a variety of reasons for that. And so what it ultimately means, and I just wanted to provide you with some visibility, that on within the response plan for individuals, we were able to go relatively deep in that analysis because that data is so contained and standardized within the homeless management information system. And so it allowed us to dig deep. And the city also had a lot of contracts in place that helped us more accurately explore cost calculations and then ultimately calculate the cost gaps that may exist. On the family side, we were challenged a little bit in pulling the data together at the beginning because it wasn't contained in a single system. This is not news. This was reported in the HSBC evaluation. But we were able to successfully, with the partnership of the actual family service providers and the county, as well as city staff, pull that data together. And so each response plan has now a system model in place that's fully accessible to your city team so that this can continue to be part of your annual planning activities and your annual budget exercises where you update this tool. And it also means that staff are well positioned to push that family analysis even deeper into the cost calculation category. But you will see some differences in the depth of that system modeling within the document. So the last thing before we jump into the individual response plans that I think is really important to highlight are the current conditions. And the current conditions are really important, and it sometimes can feel quite daunting to try to take 7 years of activity and shifts, economic shifts and social shifts, and try to distill them down to, kind of what does all of it mean for how we move forward with our next set of strategies. And so we feel really confident that these current conditions really help explain and validate why the strategies were selected and are backed up by the system modeling activities themselves. Those current conditions look different for individuals than they do for families, so we'll go through each of them distinctly, but I think you'll hopefully see a representation of all of the kind of different conditions and things that you all have recognized and shared throughout this process. I think first and foremost, what we wanted to recognize is that the city strategies are working to stop homelessness from growing, that your inflow and your point in time counts remain relatively flat, but you're really stuck, right? For as many individuals as you're getting out of homelessness, there's that same kind of volume of individuals flowing in. And so part of the objective of this particular strategy document is to figure out how to tip the scales so that we can flow more people out of homelessness than are flowing in, so that we can start to see actual reductions in your point in time count, even if we're not necessarily seeing reductions in the inflow itself. The second current condition recognized that the targeted strategies to rehouse individuals experiencing chronic homelessness are making an impact. That this was a major part of the 2017 strategy document. It's been a really central part of the city's focus and implementation, and it absolutely is having an impact. But we'll need to continue to be robustly resourced to kind of go all the way. And the model really represents that. The thing about these targeted strategies for individuals experiencing chronic homelessness is that they require sustainable funding. And so while you've kind of made that front end investment, we need to apply the same discipline to the next set of strategies. We need to be targeted, and we need to make sure that they're robustly resourced over that 5-year period so we can see the same kind of impact. The Homeless Solutions for Boulder County, or HSBC, we want to recognize that this really has worked to date to help align investments in programming. But as was revealed in that HSBC evaluation and through our own experiences in this process, that future success really hinges on deeper strategic alignment and in particular data sharing. And this was absolutely recognized in all of our provider sessions and among all of our partners. And I think that the process hopefully helped reiterate the importance of that single data system so that these system models can become more robust. And this overall framework can become a more practical way to create clarity about how everyone is investing in this, both the city, the county, and other partners, and where those investment gaps still remain. The fourth condition really is in regard to the parallel activities that were taking place between 2017 and today. And so what we understood is that while this system, homeless response system, was really driving on these targeted strategies to rehouse individuals experiencing chronic homelessness, to bring more crisis and safety to the community through the expansion of the night shelter and the day services center. There was also parallel activity taking place to engage individuals who were sleeping rough or sleeping outside, and to begin to manage public space in a very different way, helping to push these individuals into those care environments that the city was investing in. And that really has put Boulder on a path to end unsheltered homelessness through deeper integration of these practices. I want to appreciate that anytime we say things like end unsheltered homelessness, it feels very lofty. But the system model actually really supports that it's possible. And I want to recognize that you've already started to see this in practice become a reality, right? The Boulder Creek corridor looks very different than it did just a few years ago. And it's because of these very intentional parallel activities that ultimately need to be deeply integrated in order to see even kind of more substantial results across the entire city. Boulder has mobilized incredible investments toward deeply affordable supportive housing. There's no doubt about that. You're maximizing your development pipeline over the next 5 years. But we would be remiss not to acknowledge that there's still gaps in the housing supply for everyone at all affordability levels. But also, there are some unique conditions within Boulder where individuals traveling to the community with limited resources want to experience everything that Boulder has to offer. And there may be limited opportunities for those individuals. And so the strategy really needed to contemplate, is it the responsibility of the homeless response system to absorb those individuals, or are there other ways in which this strategy could contemplate how to support more balance between individuals within this community experiencing homelessness and others who may be just traveling to the community to experience Boulder for a short period of time? And finally, and I think what is probably capturing the attention of many at this current juncture is a relatively small percentage of individuals who are experiencing unsheltered and sheltered homelessness, who have very severe behavioral health issues and substance use conditions, who really do need access to higher levels of institutional care. And those levels of institutional care are just not readily available locally at scale. And so I'm not necessarily talking about involuntary commitment, but there are ways to bring individuals into crisis care today, but there are no beds to help keep them in that care, even under a voluntary structure, where we can more successfully provide for continuity of care and ultimately appropriate discharge into the right type of long-term environment. In many cases, that's not a long-term institutional environment. It's into permanent supportive housing or into other appropriate care environments. But we are not Boulder lacks the ability to kind of support that transition successfully, and individuals end up cycling between that crisis care and the streets themselves. And it's really creating a real strain on the community. When it comes to families, the conditions look quite different because, for the most part, Boulder has a very small number of families experiencing literal homelessness. And I just want to applaud the community for that result. And that result comes from a very intentional choice over these years to really focus on prevention, to focus on the avoidance of displacement, and really try to support families to remain stably housed within the Boulder community. And so that system is really reflected here in the current conditions, that many families served by the city's stabilization programs are from Boulder. And what that tells us is that the economic shocks that are affecting so many people across the country, they're really having impact on local families who desire to stay in the community. And so that was an important indicator for how to shape the core strategies that you see in this particular document. Again, Boulder has invested heavily in its affordable housing stock since 2017, but there's still limited availability of attainable family housing. That increases in cost of living are creating continued instability for thousands of families in Boulder. And we needed to think more comprehensively about how we might tackle that and then distill it down to a set of activities that felt reasonable over the next 5-year period. And finally, what we recognized is that a formalized family response system in Boulder would be positioned to focus on preventing literal homelessness among families with practices and policies that are distinct from those serving literally homeless single individuals. In essence, we needed two very distinct plans, and not a single strategy document that tried to combine those strategies. So you'll see both of these plans rely on the continued expansion of affordable housing, but each kind of recognize a distinct set of implementation priorities that will impact these populations distinctly. So with that, I am excited to jump right in to the to the meat of this, which are the two particular response plans. So we're going to start with single adult individuals, and what we've developed here is a roadmap to end unsheltered homelessness. So there's a big vision from the 2017 document, which is about kind of housing stabilization for everyone. And what we've said is we really want to focus on ensuring no one's sleeping outside as a kind of critical goalpost in getting us there. And so over the next 5 years, what are the two key milestones that we should focus on, that we should strategically advance in order to reach that larger goalpost? So the first is the elimination and prevention of long episodes of homelessness. And we define those long episodes as over 365 days, so over a year. And it is critically important to eliminate those long episodes of homelessness because those individuals are taking up a shelter bed for a very long period of time. And when you have continued constant inflow, if we're not turning those beds, right, in a meaningful way, then that's how kind of we overflow and we see folks sleeping unsheltered. So working to eliminate anyone who has a long episode of homelessness, prioritizing them for placement, right, in toward an appropriate exit pathway, and then working in a very deliberate way to prevent long episodes of homelessness in the future become a critical part of those implementation activities. The second milestone is designed to reach an end to rough sleeping. So this is building on the work that's been done to date and the very thoughtful, the very targeted and careful way in which we expand the capacity of this system to intervene early and prevent long episodes of homelessness, and then systematically push more and more individuals off of our streets, out of rough sleeping, and into our care environments that we're intentionally resourcing that can produce the remedy for each of these individuals. So let me dive into the core strategies that are contained within the document that support reaching these milestones. I think they'll come as no great surprise. We need to continue to expand supportive rehousing and stabilization programs that quickly return individuals to safe and stable housing solutions. For the most part, to date, those investments have largely been in the permanent supportive housing category, and that's a really smart way to build your system. And this core strategy recognizes that it's now time to expand the types of programming that you're investing in so that you can quickly return a larger number of individuals to safe and stable housing solutions and prevent those long episodes of homelessness. And so as we get into the next slide, I'll provide some more detailed examples of how we do that. The second core strategy is about really creating local access to institutional behavioral health facilities with transitional and long-term care options for the most complex cases. As I articulated in the current conditions, we lack those beds in this community. And so this was an opportunity to recognize that. But I want to draw a distinction here. This is not something that the city can solve for. This is outside the purview of the city itself. So this is where partnership with Boulder County and with the state are going to become really critical to create these beds. So as we get into some of those details, we can talk about those implementation priorities. The third is to maximize and expand affordable housing development. This is something that is clearly already being done with your incredible 5-year pipeline. But the caveat here is to consider including alternative and short-term options for traveling and transient individuals. So right now, those options just include the emergency shelter. And perhaps that's not actually the best way for these individuals to visit, right, and participate in the Boulder community. Perhaps there are other alternative and short-term options that could be made available. So the strategy creates space for the community to contemplate that and to consider those as part of the overall effort. This becomes a really important kind of condition to consider as we look at the fourth core strategy, which is setting clear boundaries to prevent rough sleeping and ensure health and safety for everyone in the city of Boulder. So as individuals, or as the city and its partners are resourcing care environments to provide both relief and remedy for individuals experiencing homelessness, we want to shift our efforts from servicing people away from those care environments to migrating those individuals into those care environments so that they can receive the remedy that they desire. Boulder has experimented with setting these clear boundaries in a compassionate and careful way. And as we continue to make those investments, this strategy really calls for the necessity to draw those boundaries and to get clearer for everyone, including the individuals experiencing homelessness. What are the pathways out of homelessness? Or what are the pathways to experience the Boulder community that ensure health and safety for everyone? And making sure that all of our activities to provide care and support to these individuals really align with those core strategies. So I don't want to go into all of the depth here of this slide, but I thought it was important to help kind of articulate that within the strategy document, we really do build from these milestones, a set of core strategies, and then to begin to define how you implement based on a set of priorities that achieve the milestones themselves. So ultimately, the big goal that we're trying to accomplish is to end unsheltered homelessness. The way we end unsheltered homelessness is we amplify the number of individuals that can move through our shelter beds. So instead of our shelter bed serving one individual a year, we want it to serve that one bed to serve 12 individuals a year. And we do that by attaching the exit pathways to that bed at that particular scale. And so we start to free up the ability to move those beds in the way that we desire by first prioritizing current long-staying individuals for exit interventions, really tracking those individuals by name and targeting the expansion of interventions for those individuals. The second is that we simultaneously need to expand and enhance exit interventions to prevent long lengths of stays in homelessness. And this is really about integrating a much more robust suite of rapid resolution interventions. This is diversion, reunification, relocation, and rapid exit. And this community has experience with many of those activities, but perhaps not to the scale and not to the depth that is being described, and certainly has throughout the country been a recent recognition as a really viable way to move oftentimes a large percentage of individuals that would otherwise sit in shelter for far longer than they need to, kind of building up their capacities in order to move out on their own. So this is a way to kind of help with a very light touch, continue to move folks through that bed. And so there are lots of examples of these suite of services. There are organizations out there that train and support communities to implement, and communities are seeing really incredible results in helping to move a large number of people through their shelter beds in a really short period of time. So the way in which we then equally, as we're building up the capacity of the shelter, begin to drive individuals sleeping outside toward these care environments is through two implementation priorities. The first is the enhancement of crisis care and stabilization pathways for complex cases. So obviously, this is how, partnering with the state and county to secure access to those institutional beds I was describing that provide for the transitional care that individuals need. But I think there's also some practical things that the city can do in helping to consolidate and coordinate the high utilizer programs, both that the city participates in and the county, to create a single complex care team where you're working a dedicated list of the small number of individuals who need that higher level of care and are going to require, right, specialized pathways in order to ensure that they get the continuity of care that they need. When communities across the country have taken this approach, they see incredible results in moving folks off the streets who have been cycling between jail, between hospitals, the streets, and the emergency shelter for often, in some cases, years. And these are the strategies that are successful to date in helping move those individuals from that cycle and into long-term stable solutions. The complement to that then comes in making sure that we establish clear boundaries to ensure health and safety. So this might look like trying to centralize more of our unsheltered services and supply distribution into the day services center where the rapid resolution and some of those other interventions would be available. So if the rapid resolution is available within the day services center and we are continuing to provide supply distribution and other basic needs activities far from that facility, it becomes quite disconnected in our ability to deliver on the care that individuals need. In addition to that, expansion of space management and camping prohibition practices can be done then in a really targeted way in support of moving individuals toward those care environments. And there's good examples across the country, and I think good examples in your own community of how this can be done in a compassionate and thoughtful manner, but also ensures that you're drawing a clear boundary and a very reasonable boundary within a community, as long as things are being resourced within the shelter environment that makes it possible to deliver the remedy to individuals. So contained within the strategy document, I apologize, is the system modeling as I've described. And one of the products of the system modeling exercise is the ability to articulate for the entire annual inflow. And in this case, we calculated 1,250 individuals. What are the categories of exit pathways, and what do we lack in each of those exit pathways, and how much that might cost to fill those gaps. And I think what you can see here is that this allows us to really contemplate what is an optimized response system. And in our optimized response system, we would be positioned to rapidly resolve and immediately return or rapidly exit individuals to safe housing. That would be 60% of that inflow would go through that programming. So not, it's not that they could be completely diverted from shelter, but 60% could be supported through a rapid resolution strategy. About 20% will use shelter to then exit into an affordable housing unit that you've developed through your pipeline. And then another 20% are likely to need some form of rental subsidy and stabilization services, either in a time-limited way, which is the bulk of those individuals, and in some cases, in a much longer-term way in order to ensure stabilization. And what that ultimately creates for us here is about an average time from entry to exit in an optimized system of 46 days. We want 0 individuals experiencing long-term homelessness, and we want to see fewer than 9% of the individuals returning to homelessness that have flowed into our system and flowed out of our system. And so this is the optimized state that we're aiming toward, and the framework and the roadmap that we've provided for you. Finally, within the single adult system, we're recognizing here that there are a combination of programming and components that should be invested in order to achieve these results. It's detailed within the document, and I think this slide nicely corresponds to the activities that we just described in the previous slide. I want to note here that under the health and safety response, a substantial amount of resource today is going into targeted unsheltered engagement. And over time, as we manage public space more effectively and we reduce the number of individuals sleeping outside, more of those resources can ultimately be shifted into supporting the acceleration of exits. And that's the balancing of the system that the system model really contemplates. So last, but certainly not least, is the family response system. What you'll see is that within the context of the family response system, the community set a relatively ambitious goal of a goalpost of thinking about how do we stabilize all low and moderate income families in the community of Boulder. And so this felt like a pretty lofty goal, but when we started to really look at the data, what we found is that there was a pretty logical milestone available to us, which is scaling a family response system to stabilize all families with children living in Boulder at or below 50% of the area median income. What we discovered is that the city of Boulder programming is serving about half of those families today. So this felt like a reasonable stretch goal within a 5-year period to work toward. The 3 strategies are pretty straightforward here. We need to formalize a Boulder family response system. There's been some incredible work done between the city and the county and the family service providers to create this collection of programming. But the more that the city can take charge in helping to formalize and standardize those solutions, the easier it is to scale those solutions and to align resources across partners. What's going to be critical in making that possible is a shared data system. And I just want to appreciate within the provider work sessions, the city and the county and those family service partners were thinking so far ahead at the possibility for utilizing predictive analytics, and really recognize that if we could use other data indicators to identify families who are at risk of homelessness or housing instability before they're even raising their hand, we can actually avoid displacement and really support more economic resilience within the community. And that it starts with a shared data system. And so this became a really critical part of the conversation. And finally, it goes without saying, we need to expand accessible housing options for families. And, that really looks like not just the continued expansion of the development capacity for affordable housing, but it looks like the integration of particular supports within those environments as well, like case management, critical time intervention, economic empowerment tools, and residential services. So the idea is that when each of these core strategies, look at over the next 5 years, these particular implementation priorities, that's how you're going to begin building that system that supports housing stability and economic resilience. And it really is about avoiding displacement of families from the Boulder community. Contained within the document is a bit more of a detailed map here because there are multiple pathways that we're describing. What I want to note is we calculated about 1,700 households annually who are at or below the 50% of the area median income, and those are households with children. And please note that about 76% of those are modeled here to go through prevention programs. So this is about keeping them housed in where they are, and only about 24% of those individuals may fall out and require emergency housing and other rehousing solutions. What's great about that is prevention programming is a much lower cost investment, and reduces trauma for families and children. And just there's so many benefits to the prevention programs. So this is just a really exciting model for a community, because most communities just aren't as well positioned here as you are in Boulder. So finally, I just want to appreciate within the strategy document itself, you'll see a series of charts, both in the individuals and within the family side, that allow you to recognize within those categories that I was just described, and all the way down to some of the programmatic investments, you can see where the existing inventory is supporting, and then where there's inventory gaps relative to meeting those bigger goalposts that we've described. And so the intent here is that this document becomes an operational tool for your staff. And how you as council interact with this document is through the budget process and the ability to evaluate how your investments have advanced you against this overall framework and towards your goals, and what are the key next investments that are going to help move you incrementally, right, toward where you need to be, or the adjustments that you may need to make given a shift in conditions. So we're really excited that we've been able to leave staff with those tools. And I'm excited that staff, I think, have already begun to implement these activities and have a lot to share with all of you about how this strategy framework is already being implemented. And so I think with that, I pass it to Megan.
Good evening, Council. I'm Megan Newton, Homelessness Policy Advisor with Housing and Human Services. Our updated strategy is launching, as you know, in a context of a challenging financial environment. So we're looking closely at what we can do now that is both impactful and feasible within the current resources we have. So for the single adult homelessness system, we've identified some immediate steps, some already underway, and others that we can move forward on quickly, that offer small but important wins in coordination, effectiveness, and system performance. On the slide, you'll see some of the early progress is that we've clarified governance roles within Homeless Solutions for Boulder County, HSBC, and now each participating jurisdiction now designates its own representatives. And we are also adding 2 nonprofit organizations that have actually already joined the board. We've begun working with the emergency shelter system to identify ways to further strengthen operations. This includes efforts to make the most available beds available and enhance the shelter's role as a key system resource. So some of the stuff that Mandy was saying, being able to turn the beds over quickly and pushing folks to those resources from the central core. We've also started reviewing options for the centralized data collection. As you all also heard when we did the HSBC system evaluation that was recommended. Right now, programs operate multiple systems, which limits our ability to do this kind of work and evaluate system-wide performance. So we're exploring ways to transition into a single shared data system. And some of the opportunities we'll be looking at for the next couple of months is we want to, as Mandy suggested, we want to revisit prioritization practices to ensure the individuals with the longest term stays in the system are higher on the list and prioritized for whatever the appropriate housing placement might be. And we'd also like to explore standardized diversion and navigation staffing. So dedicated staffing to work through some of that stuff that she suggested with finding the right housing resource and the rapid exits. And this would happen in both the emergency shelter and in outreach settings with the folks that are doing that work out in the field. We want to work with the frontline staff at both the shelter and in outreach to align messaging so that individuals receive realistic, consistent information about housing options. I was in a meeting today where we were already discussing with outreach workers some of the language that they're currently using and how that's transitioning. And then finally, we want to look at the data integration. So once we get operating in one system, it'll
enable us to do more of this analysis, kind of repeat what Mandy's already been doing on a somewhat regular basis, so we can see the strides we've been making with the changes in the system. Now going to turn it over to Elizabeth Crow to talk about some of the work that will be happening in the family system.
Thanks, Megan, and good evening, Council. Elizabeth Crow, Deputy Director, Housing and Human Services. Just a quick follow-up on what Mandy shared earlier about our family homelessness system, little s, as it exists now. As Mandy said, we're very fortunate in Boulder and within our region to have so many services within the city, and then through our partner agencies, that we've already been making some great progress and maintaining good progress and meeting the needs of families who haven't experienced homelessness, and to move those families who are experiencing literal homelessness onward into a better situation as soon as possible. Just some of those programs within the city include our family resource schools and older adult services programs that have the ability to help families, including multi-generational families, who need that assistance financially in order to stay in their home. And also our eviction prevention rental assistance program, or EPRIS, which is both executed and implemented by our city staff, as well as through a partnership with Emergency Family Assistance Association, or EFA. And then, of course, in addition to EFA, we also appreciate our partnership with the Safe House, SPAN, our domestic violence shelter, for the assistance that they provide to survivors of domestic and intimate family violence and their children. So as Mandy shared, a lot of these organizations and institutions are in place. We communicate and coordinate very well with each other. And what we lack is still a more formalized system that has the ability to really map the programs and funding streams so that we can more precisely see what those outputs are. Where we have resources, we have really good outcomes. And as you well know, resources are yet scarce in terms of reaching those goals. But really being able to map the systems out and track some of the funding streams toward those outcomes and impacts. Similar to what Megan shared, data systems is another area where we can expand and have a lot of potential. Again, in terms of staffing, kind of dollar resource capacity, we'll see what we can advance kind of in this climate with our fantastic partners at Boulder County and our nonprofit agencies. And then lastly, I think, well, it's known, right, that people who are experiencing low income oftentimes can use and make very good use of financial coaching, financial literacy, financial planning tools. I will say there are many people in our low income community that have those tools and resources, either because they have had them and had that knowledge and awareness and practice for quite some time. And that knowledge doesn't necessarily help you if you don't have the resources to plan with. And so we definitely have families in our community that really need that financial coaching. And there also is a network, including our city staff and nonprofit partners at EFA, Boulder County Personal Finance Program, the PI program, fantastic nonprofit organization called My Wealth Being. We already connect with each other and just kind of coordinate kind of who's doing what in terms of financial coaching. And there's interest already among all of us to really formalize and solidify some of those relationships so that we can do even better at coordinating and providing those services to families so they more have the information, knowledge, and resources they need to stay housed. So those are some of the next steps for family homelessness. And I believe at this point, we are turning it back over to Councilmember Marquis.
All right. Thank you so much for all the work that was put into this presentation, both from Clutch and Mandy, and also the different city staff people who have participated. We really appreciate it. And now I think we're going to start asking some clarifying questions. And after that, we can have comments just about the direction. But as was noted, we're not making any taking action or making budget decisions. We're going to be doing that through the budgeting process. So if that works for everyone. So with that being said, are there any clarifying questions from council? Okay, Nicole, and then Mark.
Yeah, thanks so much for the presentation and all the work. My question is just a little bit systems oriented. So when we think about kind of who's responsible for different pieces of this, right? Certainly we have a lot of community partners. How does that work for the family? Kind of the ideal family setup, the ideal single adult setup in terms of the proportion of the work, the funding that is sort of city led or city derived versus nonprofit partners and others in community. And is the balance the same when we're thinking about family and single adult?
Yeah, so I would say what's typical in communities across the country is there always has to be a lead. And so that doesn't necessarily mean that that lead is providing those services, but it's an organizing entity that helps kind of coalesce all of those activities, because the truth is it takes a village. So there isn't per se an exact formula, but I would say what is pretty typical is that government oftentimes lines up to help define priorities, to help invest in those resources based on their own individual priorities, and ideally in alignment with a common strategy document. And that lead entity really helps drive that coordination through the implementation activities that are oftentimes performed by the provider partners themselves. So the typical contract from a funder to the provider kind of is the main mechanism here, but there oftentimes is a centralized entity that's doing more to actively manage and drive the coalescence of these activities. I think HSBC in your community has intended to try to drive that alignment. And I very much think that as functionally, that is still possible. Staff seem to have good working relationships there. I think the provider community themselves would like that to become a more amplified structure where they can participate more actively in driving on those implementation and experimenting in real time. So not just interacting with their government partners through contract, but in a more kind of constructive way. What that also means, like, I kind of like talked about how we go from the middle down, then there's like going from the middle up. So, there's individual authorities here. The city has their own authorities and their own priorities. The county has their authorities and priorities. What we tend to hope is that that coordinating entity is working with all of those partners to help inform and educate and drive alignment, and while respecting those priorities. So there isn't an exact formula, unfortunately, in all of this, but I think what's critical to making any of that happen is you have to have a framework that clearly articulates the what, which is what we wanted to provide for you. Like very concretely, it's these categories of activities that need to be invested in, and there needs to be standardization so that if the county is investing and the city is investing, we all understand what we're going to get equally from those investments.
Thank you. And may I just do one follow-up question, Tina? And my follow-up question there is, you've worked with a lot of different cities. You've certainly gotten to know ours a little bit more in our relationships with the county. Do you have a sense of whether that coordination that you just talked about, is it better for family homelessness than it is for single adult? Are they just two kind of different beasts I'm curious on your observations on that.
Yeah, I mean, I think this is where there's just a difference in the number of activities and the number of partners. So there are far fewer service providers on the family side, and there was some intentional work done countywide to establish like access points. And so that's kind of the beginning of kind of a natural way to drive that synergy that I was describing. And I think the city has really leaned into saying, we know where our access point is. We understand how the county is going to be investing, and we're now going to align our resources and amplify. And what the strategy really calls for in this particular case is to lean into that role even more, to really formalize and standardize that system through the Boulder access point, right? So I think there's some ease there because of some of those structural supports. That looks different on the single adult or individual side. And there's a much kind of wider array of kind of programming that goes into all of this because of your unsheltered homelessness. So there's a ton of basic needs work in addition to the activities of rehousing individuals. And when providers perform both of those, it can get very complicated because sometimes it's difficult for even those providers themselves to figure out what to prioritize, and especially when government, right, is sometimes not as clear or other funders are not as clear. So there's just, and that's not unique to Boulder. I just want to appreciate that is true, but it's not that there are not good opportunities, and there is equally a framework to drive standardization and coordination, and that has existed. I don't want to undermine anything that already takes place. There is a lot to work with. This strategy document says let's build on that, but let's build on that in really targeted ways, right?
Thank you.
Is that it, Nicole? Okay, great. Next we have Mark, then Ryan and Matt.
Well, thank you for that presentation. It was most interesting. I have a couple of questions. The first is based on, I think it was page 10. You have the chart of 1,250 individuals, 60% to be diverted and 20% to be housed in affordable housing. My first question is there a lot of track record that we can achieve a 60% diversion?
Well, so when we calculated for that diversion percentage, it was calculated based on looking at the performance of the system. And so because diversion has been a relatively small, kind of a sliver of a program in your community, and not necessarily a program that every single individual kind of, like, it's not your first triage tool. Right. So the data gets captured differently. And so what we were able to do in looking at the performance data at a system level is recognize that there's a lot of individuals that come into your shelter who ultimately stay in your shelter for a period of time and then exit and don't return. And that what we were able to do then is look at the total number of individuals who have been diverted, but who also clearly could have been exited faster had we had the ability to intervene. And that's how we came to that 60% figure. So it's not, you're right, it's not that the community has been successful to date. That program hasn't been completely scaled, but there is evidence in looking at the way the system functions historically that gives us confidence that a large percentage of the individuals, in fact, we could rapidly exit those individuals and reduce the number of days that they're in the shelter ultimately.
Have other cities hit a 60% mark?
Yeah, in fact, in many communities, when you start to organize like this, and I just want to appreciate that when you like actually organize and put diversion or rapid resolution as your front end triage tool, yeah, absolutely. Sometimes all the way to 70 or more percent can go through that pathway.
Okay. Now, this is all based on.
On that real quick.
What's that?
Can I colloquy on that line of questions real quick?
Absolutely not, please.
I'm moderating, Mark. Yes, you can, Lauren. Thank you. So you mentioned that this is just that the sort of diversion, reunification, relocation as a strategy is just a sliver. And I know our council hasn't focused on that extensively, but I've definitely heard past councils talk about that quite a bit. And so isn't that something, my impression was that that was part of sort of the initial stages of what is happening at Owl Roads and with our outreach teams. What kind of things would you want us to focus on to change that program or to improve it?
Yeah, I appreciate the question. So it's one about kind of expanding that spectrum to include rapid exit. So that, oftentimes it's very difficult to divert someone, right? It's like when I break that 60% down, the percentage that are going to be diverted is relatively small compared to the percentage that are going to be rapidly exited. So I just want to put that into context. So the model calls for the expansion of rapid resolution to include rapid exit. And then it calls for a standardization of that program model overall, dedicated diversion specialists who perform the function of rapid resolutions. We'll call them rapid resolution specialists, and a flexible fund that gets attached in order to deliver on all of those interventions. So, you're right. It's not that a large percentage of individuals are going to be diverted or even like quote reunified, like immediately. The rapid exit becomes kind of the amplification of the tool itself. But then there are also some standardized ways in which you integrate that in the front end. You change the script of the experience at the front end of the shelter or the day services experience, and you really use coordinated entry as a last resort tool in all of that. So there is some kind of programmatic and process flow adjustments that help support that. And so I don't want to discount the experience in this community and All Roads and absolutely. And like other communities who've had similar experiences, when they've made these types of adjustments, they've been able to really see a much more dramatic shift in moving individuals through that shelter much more rapidly.
Thank you. And thank you for letting me jump in.
Oh, no problem. My next question is also based on that chart. It shows 20% affordable rehousing exits for affordable housing units. Are you anticipating a major growth in private sector construction of affordable housing? Because that's pretty much what Boulder Housing Partners does in a year. So are you assuming that the homeless will have a priority on those units that BHP builds? Or how is that going to work with, let's say, 250 units to house people? And the basic mission of BHP has always been to house economically deprived people. How are those going to relate?
Yeah, so I would say everyone experiencing homelessness fits into the category of economically deprived. And so we calibrated that 20% based on the pipeline projections that city staff have. And so it is not implied that we're kind of forcing a prioritization of all affordable housing. This is over the course of a 5-year period, keeping in mind that this framework is intended to be kind of incrementally grown, right, to the overall result. And the expectation is that individuals apply to these units the same way that any other economically disadvantaged individual applies to those units. And if we want to accelerate individuals out of shelter and into those units, then we could ask for that prioritization. And in some cases, the city does in the negotiation, in the development negotiation, asks for a set aside, a small percentage of those units to be made available. But because we don't necessarily do that at scale, what we built into the model is that these individuals will actually be in shelter for an average of 120 days while waiting to qualify for one of those those existing units. And so this isn't a stretch goal. This was a calibrated percentage based on the existing pipeline and how much turnover capacity would ultimately be available on an annual basis 5 years from now. And so I would say it aims to be relatively conservative, frankly, and not try to outcompete, right? Others, but
my question remains, this looks like it would absorb the entire production of affordable housing. But let me go to the last question that I have, which is, we're obviously turning away people at the shelter. We're constrained for resources. Was any consideration given to creating a homelessness priority for people who have a more robust connection with the city of Boulder, as opposed to people who just came off the bus? And if not, why?
So absolutely, there was a consideration. And I think that that it shows up in the strategy document in a couple of different ways. So first, it recognizes that there's a series of individuals who come to this community who are low income and don't really intend to remain in this community, and that they are taxing this community. And we think that you could explore alternative options for those individuals and equally set some clear boundaries that starts to make some of those changes. So that's one way in which we absolutely contemplated, and it's recognized in the strategy. The second way is through this expansion of the diversion, reunification, relocation, and rapid exit, and the modification of the script on the front end of all of this. So rather than trying to say Boulder resident versus non-Boulder resident, what this really says is it's more than just one indicator, right? We triage. And if we're triaging, and one of the things that we recognize that this individual is not from this community and is not intending to remain in this community, it doesn't make sense to put them on a list for housing in this community, right? But we do need to provide an appropriate pathway out of homelessness, or right, through a reunification or a relocation opportunity. So that it shows up in the document in a more functional way, because historically, drawing that arbitrary line really puts municipalities in a very difficult position, frankly. If the shelter is just decides not to service those individuals, and those individuals end up sleeping outside as a result, the city really has to make some hard choices about how to manage in that moment. And what we wanted to do was, with this document, instead, is to say, yes, let's set some clear boundaries, because that's reasonable and important. But equally, let's make sure that we're providing appropriate pathways for individuals. But that pathway doesn't have to be a rehousing service in the Boulder community. It can be, right, appropriately, we've got to, housing isn't going to happen here. So let's find an appropriate option. And sleeping outside isn't it.
I have many more questions, but that's enough time for me. I see 4 people lined up. I'm going to yield any time I have left and let others question. Thank you.
All right. Thank you, Mark. Next we have Ryan, then Matt and Aaron.
I have 2 questions. They're kind of high level. Kurt, I think I'll address you to start with. Can you provide just a simple way to understand the role of the city versus the role of the county in addressing homelessness?
Sure, thank you. And I also may lean on both Megan and Elizabeth as well to provide a little bit more detail. So the one thing I'll start off with is, and it's covered partly in the strategy as well, around behavioral health. And it was mentioned earlier by Mandy. Behavioral health, public health fall in the realm of the county. I would say that we work equally with Boulder County and coordinate very collectively with the city of Longmont. And through HSBC, we look to align certain programs with the funding that we have, that each of us has available. So as an example, Boulder County supports coordinated entry component of the services. And we provide a variety of approaches around housing. Of course, the day service center, specific services within that, the staff that help transition individuals into housing, and the city also supports programs that help keep people housed, and those are that's peer navigation and staff involved in the Building Home program. But I'm going to ask Megan for a little more detail on that if she has it. And then there's also the family side. And I think Elizabeth can do a great job of breaking out how that is dispersed between the county and the city.
Yeah, Kurt, I think you did a really good job there. I think the one primary bucket is the behavioral health. Everything else we kind of braid and blend between us, the county, the state, and some federal resources, the housing stuff. And so in the single adult world, it is behavioral health that tends to be a distinct need and something that we aren't really able to address at the municipal level.
And I'll touch really briefly on the family side of things. So structured differently, there is a network, as I mentioned earlier, of county staff, specifically within the housing stabilization program, that work with countywide and with both school districts, Boulder Valley School District, St. Vrain Valley School District, a plethora of nonprofit agencies to try to coordinate the prevention side, as well as bridge housing, case management, just other services that families need in order to maintain housing or get housed. And also, again, with the domestic violence shelters in our region. One place where we do connect and coordinate is through the Family Resource Network's Family Homelessness Subcommittee. That is a network that is, for the most part, kind of staffed by Boulder County staff, and with rotating leadership for the Family Resource Network, as well as the Family Homelessness Subcommittee. And so there are also, I think, differences there. And again, like that network for family homelessness is less formal when it comes to having one specific strategy, data sharing, et cetera. But the county is a very heavy player and strong kind of player and leader in that space. And when it comes to City of Boulder, we most directly connect with between the city for some of, like, as I mentioned earlier, some of the programs that we have uniquely, the EPRIS program for eviction prevention, the support that we provide directly to EFA and SPAN, for some of their services, and also through our Family Resource School and older adult services. So some of those kind of connections, partnerships are robust kind of on their own without, county engagement. And in the larger regional sense, we partner very closely with the county in those other ways, including, again, helping to staff the Family Resource Network.
Thank you very much. I just have one more question. And it's thinking about the new update, the new strategy update. What, if anything, are new notable concepts or departures from the way that we've done things before, new change models, new inspirations, just like what's new in here, if anything, compared to how we have approached the issue before?
So I'll start again, and then Megan Elizabeth may also have other areas to add. So I think one one which is new, but has been evolving since the beginning of this year. It's around sort of the alignment of messaging and sort of setting expectations for individuals who are new to the community experiencing homelessness. That's something that, as Megan said earlier, we're building upon. And also the messaging as they enter services. I mean, obviously the conversation around diversion, family reunification was brought up earlier. That's part of the playbook currently. We've diverted 777 individuals since 2017 through that. So it's roughly 100 people a year. So I think part of that is also increasing the resources. So currently in this year, we only have $45,000 set aside for city resources to support the shelter and, I'm sorry, all roads and focused reentry and direct costs related to that. If that was further resource, that could have a significant impact. I think there's something that we've been talking about for the last year within HSBC is expanding permanent supportive housing, and this document reinforced that. And I think expanding PSH to other communities within Boulder County. Currently, all the PSH housing lives in Boulder and the city of Longmont. So the city of Boulder actually provides a regional support for individuals experiencing homelessness, and I think we need to work on having a more regional approach around housing as well. So Megan, do you want to? Is there other areas that you're thinking that I'm missing, and Elizabeth around family aspect as well?
I think I would just add kind of what Mandy called out a little bit earlier, is that we have been doing the diversion and the reunification, but a rapid exit, which is similar, but gives a little bit more resource heavy. Some more like normally when we're doing reunifications and diversions, it's like a one-time cost of something. Might that be gas cards, or it could be, you know, getting back with your grandmother or whatever. But with the rapid exit, there is some flexibility to that financial assistance that might be, we're going to pay your rent for 3 months or something like that. We have not historically done that, so I do think that would be an added exit that we haven't utilized before. But to Kurt's point, we just need to resource that appropriately.
I think on the family side, it's really, as again Mandy shared and in the report, is really about scaling up in many ways the things that we're already doing. I think the substantive difference in the way that the family homelessness, you know, strategy, the recommendations are, is just naming the impact of a boldly proactive approach. And I think where that's different is I think the city and all of our partners are working really hard just to meet the demand that is just right here and present. The lines continue to grow, if you will, of people who need rental assistance, who need that that prevention assistance, and the amount of resources that people need in order to become kind of whole, much less kind of achieve that bridge to financial stability, is just more and more every year. And so to me, by kind of naming the number, like this is what we're after, we're acknowledging that people of low income, many families of low income, whether they're, you know, kind of month to month, able to make their rent or not, are potentially at risk of losing their home. And so the difference is really that scale of approach and really setting a pretty bold goal and strategy for how we could really long-term address the need for families.
Thank you. Thank you for that.
Is that it, Ryan?
Yeah.
All right, Matt.
Thanks, Tina. Just again, I'll pile on the wonderful presentation. I'd say this is kind of a long time coming to kind of get this clarity for this next chapter in how we evolve on this. So I appreciate that. I've got a couple questions. One, maybe piggybacking on some of this discussion of all roads in the county. Given the county has no cohesive regional strategy to address homelessness, and that we've seen, the city and the county at odds about what to fund, and all roads being somewhere caught in the middle of that in an unfortunate manner. And in this strategy, all roads is taking an enhanced critical role in what we're trying to achieve here. Is there a recommendation or strategy built into this to how we maintain the stability financially and programmatically of the shelter? Because it seems like more now than ever, or in the future, all roads is going to be such a nexus for all this. And we already saw the county cut a bunch of money from all roads, and that sort of, then we had to compensate. Their capacity came down as a result. And so if they're at the mercy of a county who doesn't have a plan and certainly hasn't adopted or agree with this plan, how do we inoculate the shelter and all roads? How do we keep them stable so that our strategy has the pathway to success?
Yeah, maybe I can start and then Kurt and his team can build on this. But so what I witnessed in this process is that county staff actively participated in the development of this strategy. And so while that doesn't, necessarily authorize the county to be in alignment, I want to appreciate it's a really kind of important foundation. So there's opportunity here. HSBC as an existing structure allows at a staffing level that continued alignment while still respecting kind of the autonomy here. So what the framework of this document, ultimately represents is the ability for city staff to go to the table and say, at an operational level, here's where we're going to drive investment. Where are you going to drive investment? And at least creating some clarity about those particular elements. And none of that will be a surprise to county staff because they helped inform this process. I think what that does then is positions, kind of, each respective entity that, you as city council members and the county commissioners to really contemplate the opportunities to drive alignment. But even if there isn't kind of a formal adoption and all of that, it doesn't mean functionally that there couldn't be alignment, and that the city can carry back from those HSBC environments the opportunity to inform, right, on how functionally this is taking place. The strategy update, because it's intended to be a strategy update and provide the roadmap, doesn't provide for an exact annual action plan to respond to the all roads conundrum, right, that you represent here. I think though, what the strategy document clearly articulates is you must sustain that capacity or you fall out of balance toward reaching those milestones. And so that really then creates a natural priority at the staff level to really work to try to negotiate for how to do that. I think you happen to be in a year where there are extreme constraints and a lot of unpredictability in resources that the county is really bearing. The county, like every other county, is bearing a lot of that weight. And so it creates some kind of muddiness in this moment, but the document is intended to try to allow everyone to anchor to that, to weather this particular storm. And I think it relies on staff to set those annual priorities through a budgeting process, relative to what we think the county is going to be investing. That may change year to year where you all put your resources if you're successful in gaining that level of visibility. So that was what I witnessed in this process, and what part of what helped shape the document in front of you is to try to create that opportunity. And Kurt and team, I'm curious.
Mandy, if you don't mind, just quickly, Mark Wolf, Assistant City Manager. Just wanted to also recognize that we are joined tonight by Mike Block, CEO of All Roads. Wanted to just triple down on some of the appreciation for him and his staff participating in the process, the board's engagement at All Roads as well. So just a critical partner to make this strategy happen, and recognize the funding challenges that we're all facing, but certainly can't do it without him, and just wanted to make sure council was aware that Mike was joining us tonight.
Yeah, so Matt, I'll try to add a little more local color to that question as well. First of all, I'll start off by saying I'm a fan of HSBC, and I can say that because I'm on the executive board. But I also lived in this world and in this challenge before HSBC, trying to do this work, and I think HSBC has really brings together Longmont, Boulder County at a staff level in a very effective way. It doesn't mean that it's easy or we always get along or agree, because it's really tough work. But I think there's been really good coordination around the resources that we do have. And there's other organizations that are impacted by challenges that you mentioned, like Together as well, and the closing, the recent closing of their youth shelter, which has an impact on our community. Where the staff doesn't have the same necessarily influence is through the budgeting process or the resources available. And HSBC works with the resources that have been made available through our councils of Longmont and Boulder and through the county commissioners of the county. So I do think that your question lives both at that level as well as at the staff level. And I also think we're entering a very difficult time, and both organizations also apply for outside funding from state and federal sources at a very aggressive level, and we've been successful as a community. But we also know and see that is changing, and so I think the coordination that you're asking for is probably going to be more critical now than it has been.
I appreciate that, Kurt, and I appreciate the response. And Michael, it's great to have you with us. My next question has kind of circled back to some prioritization, which is obviously to do this at scale, sort of forecasted to have quite a price tag. And so I'm wondering, how do we prioritize, as hopefully sooner rather than later, Nuria, our financial situation improves more rapidly? But as those resources come available and there's a choice point to invest in this work, to scale it and accelerate the work, how do we prioritize what aspects of this get, the first 500,000, or if we've got 3 million, like how do we properly invest that money as it comes on over the next couple years, hopefully, and properly and most effectively insert those resources into this strategy to maximize impact?
I'll start. Oh, Mandy, you want to go ahead?
No, go ahead.
Well, I was going to say, I think this roadmap is really what gives us the path in which to start. But what I was going to say is, without getting too ahead of our budget presentation, you will see that we will be starting that actually. And you will see some of that alignment as we move forward. While we are in I have yet to find the word that will replace fiscally constrained for this year. I got till budget to figure that out. We know that this is the way in which we want to move forward, and we will make some hard decisions as we go. And the team, and I just can't speak highly enough of our HHS team who has looked at this roadmap and who has said, this is how we are going to shift. Because we will not get there if we do not make those hard decisions that say, this is the alignment that we are going to make. So this allows us the prioritization roadmap in which to move forward. Now, again, we do not do this alone. And to do this effectively, we will need to continue to talk to our partners in order to maximize those dollars as we continue to move forward. But it is with this tool that I believe that we will be using our dollars the most effectively as we go. It is how we will think about not just how we use our own dollars, but how do we apply for grants? How do we think about what investments to make? This provides us that pathway. Mandy, what have I gotten wrong? Or Kurt, what did I get wrong as we think about that?
I think that's beautiful. The one thing that I would just add is that there are investments that you've already made that need to be both sustained and prioritized, like your permanent supportive housing pipeline. And so I think it's not lost on anyone that there are lots of different opportunities for partnership in the expansion of that pipeline, which then could open up your ability to expand your priorities deeper into this particular framework. So I think very obviously priority one is to sustain and make and ensure, right, that all of what you've invested in, right, it has impact. I think the second is there are oftentimes there's a natural opportunity to want to tackle that 60% or get as deep into that 60% as you can and really start to drive more diversion, reunification, relocation, and rapid exit. And it's a relatively low cost per person. So, Mike Block said it at an event earlier this week. I mean, Kurt has said it. You guys have proven you can have impact, but you've had a very small amount of dollars. So it won't take if you can incrementally grow those pots, you can probably see some pretty big results. So I think those are the types of that's like the decision calculus that likely we've been talking in background with your team about, kind of thinking through and how to support those priorities.
I appreciate that. That's a great answer and helps out a lot. I appreciate it. That's it for me.
All right, Aaron.
All right, thanks everybody for the fantastic presentations and the extraordinary work that's gotten us to this point. I really appreciate it. My one question, we just talked a little bit about dollars, but just there's so many good ideas in this plan. As we have an incremental amount of time or incremental dollars available, how do we determine which of these things we would tackle in what order? Like what's the process going to be for that? And I know we've been at this for a while, so if there's a kind of a quickish answer to that, I would love to hear it.
So I'll jump in here, Mandy. I think it's similar to her previous response. I think the lowest cost intervention is going to be increasing resources further around diversion and reunification and the efforts around that. The sort of the two areas of strategy that she spoke about, the other one was those who have been in our system for way too long. They have been unhoused for way too long. That's going to be solved in part by continuing to implement our housing pipeline. And we need to have both the units and the vouchers to accomplish that. I think that the headwind we have for that particular strategy is the significant reduction in vouchers that we're seeing throughout our community and other communities across the state. We're going to have to monitor to see if that moves in a more positive direction over next 2 or 3 years. But we need to start creating the housing now for when those vouchers become available.
Thanks, Kurt. That builds well on the previous answers. That helps me to understand that. Appreciate it.
Okay, Lauren?
Thank you. I also appreciated the presentation very much and all the thought and data that went into this. I had a couple of specific questions. First, when you say we should set boundaries to rapidly reduce the number of unsheltered individuals, what specific actions do you mean? You also recommend expanding the SAMPS model to better manage public spaces. And I'm curious how much expansion you're suggesting, and given our limited funds, how we balance these priorities.
Yeah, that's a great question. I don't think we're necessarily advocating to expand the SAMPS program, but I think what we're saying is, as you start to make headway in reducing the number of individuals sleeping outside, their geographic presence, right, the space that they manage can grow. So I think that's a good point of clarification here. And speaking from experience, there are ways to kind of continue to maintain those public spaces with kind of less effort, which allows you to take that targeted capacity and kind of move it out in different ways. The complement to that around the setting those boundaries, I don't think setting those boundaries themselves is how we kind of rapidly reduce, right? It's all the boundaries are setting those boundaries as part of a complementary, or it is a complementary strategy to helping to kind of move individuals closer to where we're investing in the solutions for those individuals. And I think what's contained in the document as an example is, right now there are lots of supply distribution activities and feeding activities that occur, and those occur really far from the day services center and the night shelter. And here the city has made important investments in those environments to try to produce more care and support for these individuals, but we're keeping individuals relatively disconnected. So that's one way to start to do that. I think another way that's articulated in the document about setting clear boundaries is shifting the script and getting a bit more honest, and I think Megan mentioned this, getting just a bit more honest about what is possible and what isn't possible. So this idea that every person experiencing homelessness in front of us today is somehow going to be able to live and be fully integrated in housing in Boulder, it's just not fully achievable at this juncture. And telling someone it is, or pretending that it is, actually can be harmful to that individual. Like the idea that they're just waiting outside until that happens. So, really working to try to set a clearer boundary about what's possible and what isn't, so that we can work in concert with those individuals to figure out the right solution for them as quickly as possible. So those are some examples that we tried to really articulate in the strategy as ways to move this forward.
I appreciate that. Thank you. That's helpful. You also mentioned one recommendation is to consider opportunities for private sector development of short-term affordable accommodations, such as micro units, boarding houses, and hostels. Are there other short-term options we should explore? I've heard from community a lot of interest in ideas like tiny home villages or sanctioned camping.
Yeah, I'm glad you're asking this question, because I think it's important to really draw a distinction here. What that statement in the strategy document really is pointing to is there needs to be more affordable options for individuals, which is really different. Like these tiny home villages and sanctioned encampments are not about affordable options. Those are containment strategies for individuals who are experiencing unsheltered homelessness. That is not what that, right, is intended to elicit. Instead, what it's intended to say is, if somebody wants to come and climb and experience Boulder and they have limited means, sometimes what happens today is that they sleep outside in your community. And what if we could have some affordable alternatives, but that's really different, right?
Yeah,
Than
that makes
other
sense.
strategies. Yeah.
What do you, I guess then this didn't really weigh in on strategies like tiny homes and sanctioned campgrounds, did it? How does something like this play in, or why wasn't it included?
Yeah, so the HSBC evaluation, I think, provide and our job was to build on that, so not to repeat it. And it provided a pretty clear recommendation, and felt consistent with, I think, some other conclusions that City Council had drawn previously as well. So I don't know that there was necessarily a reason to revisit it. In addition, what I will tell you is the system modeling really suggests that we want to minimize the amount of investment in our crisis and health and safety in order to maximize our investments in remedies. And so we have to balance those, obviously. But if we invest too heavily in crisis and health and safety response, then we're actually kind of entrenching individuals in crisis because there's no way to get them out in a timely way. And so tiny home villages and sanctioned encampments really represent an expansion of those types of environments, not necessarily of the remedies themselves. And they're really expensive, oftentimes more expensive per person than a full year's worth of rehousing and stabilization supports. And so the economics just don't work, and the strategies just don't work to accomplish the goals. And so when the community through these work sessions really began to set the stretch goal of saying, we really think we want to point to a goalpost of ending unsheltered homelessness, those solutions just ceased to be a reasonable way to accomplish that, given the balance of what was needed.
Thank you.
Can I comment to Lauren on that one just for a
sure.
second? So
Tina says yes.
Tina says yes. So I just have a quick question about the tiny home villages, for instance, in Texas. Are you saying that those models are all in the help people? They don't live there forever and ever. They're just for a short period of time. And it is, I'm just curious why you don't think that that's valid housing, or maybe I'm thinking about the wrong type of tiny home village. Can you just, you know what I mean?
Yeah, sure. Great question. So the one primary Community First Village is the big kind of primary village in Texas. So first, just know that Community First Village, is camping sites. It's RVs. It's tiny homes, but tiny homes without bathrooms, tiny homes, right, without kitchen facilities. So traditionally those don't meet habitability standards for like long-term remedies. So I don't, it's this is a tricky kind of conversation in terms of splitting hairs, but at the end of the day, that those are approaches to expanding kind of sheltering within your community, and people do live there for a long period of time, but those were that's all historically been privately funded because it didn't meet those habitability standards. Now there has been some expansion, and there is expansion planned that looks more like traditional development, and they will qualify for some of that expansion. So the way I look at some of that is like a modern version of a mobile home park. And so it's a perfectly viable, affordable housing solution to consider as part of your affordable housing pipeline. But when it's set up as we can just go, create a village and everyone can go there and everything's going to be fine, with the expectation that we want people to move out of that village, right, in a timely manner, then that puts it into the category of interim housing. So I'm not telling you it doesn't.
No, I get it.
Have a place, but
yeah, you totally made it clear, and now I get it. I think I forgot, and you reminded me of the different type, the iterations of that. But you're right, and thank you for clarifying.
Sure.
I had one final question, which was just, I assume I do see Brad on the call, but I didn't prep him for this ahead of time. I was wondering about if we could get an update from planning about the barriers to the kinds of private sector development for short-term affordable accommodations that were highlighted, like micro units, boarding houses, and hostels.
Good evening. Brad Mueller, Planning and Development Services Director.
What happens when you're on the line, Brad?
That's right.
And
Interested listener.
This could be information later. Yeah.
No, that's fine. I appreciate the question, and it speaks, I think, to the larger theme of it being a holistic challenge that runs the whole spectrum from unhoused to fully housed. So appreciate the context and question. Boarding houses and tiny homes, quote unquote, and small subdivisions are fundamentally allowed by the code right now. There could be some nuance that could be looked at in terms of setbacks and things like that. But a lot of times it gets hard to assemble that type of property or to overcome individual taps or things like that. I think council's leaning into zoning allowances for ADUs and for duplexes and quadplexes on places that formerly were really restricted to single unit lots, moves along that way. But certainly if somebody came along with a project that's kind of being envisioned, we would be eager to work with them, and in many cases there might be a way to get there. Did that answer your question? I'm sorry, I kind of caught it on the back end.
I appreciate you jumping in, and I think I might follow up outside of this as well, but that was great.
Thanks.
Thank you. That was it for my questions.
Great. Okay, next we have Taisha.
Awesome. Awesome. Thank you very much. So I just have a couple of questions. The first on the engagement to inform this strategy. I couldn't find the slide, but I was just curious. The mention of Malcolm Block and just the work that All Roads has done with the surrounding community and neighborhood there over the years has really been in the direction that we want to move in. So I was just kind of curious if HOAs or neighborhoods that are in the vicinity of where services are currently being held or considering being held were engaged in this process.
So what I can answer is no, they were not explicitly engaged to participate in the work sessions. Individuals with lived experience were the providers, yes. Area administrators and the likes. So I suspect.
Okay. That's fine. I just needed to answer on that. I'll have comments later. I just wanted to make sure I didn't miss it, because that's really a critical population and stakeholder group, and I wanted to make sure that that I was clear on that, and whether or not this feedback and all of the strategy had their information as well. And I can share more why during the comment phase. The other question I had was on on why an equity analysis is not being considered until the programmatic level, given that an equity analysis needs to be both at the systemic and programmatic level. So since there wasn't one done at the systemic level, although I appreciate racial equity tools, et cetera, being used at the programmatic level, as an equity specialist with over 30 years of experience, I know that it's the most important actual impacts that you can make is at the systemic level and not at the programmatic. So can you just share a little bit more about why that decision was made? And I don't need to know what's going to be made done in lieu of that, because the ship has already sailed on that. But if there are opportunities to do an analysis on the actual strategy and the framework itself, and not just program by program.
Yeah, so our contract didn't include an evaluation, right, of existing programming through those lenses. What you'll see in the strategy update document is it absolutely points to the necessity when measuring success and through the utilization of dashboards, that that equity needs to be tracked and actively understood, so that appropriate systematic and programmatic adjustments and an understanding of that relative to the annual priorities can be supported.
Okay, and is there an equity definition or, kind of what you're using, what is equitable practice? I haven't seen anything, and I'm curious what you're using to guide and inform your canon.
No, I don't think that there's a formal definition beyond what's been embraced by the National Alliance to End Homelessness, which looks at how individuals are served by the system, right? So it looks at not just the racial demographics of individuals as they
the outcomes of the effort, yes,
but absolutely how they flow through and how they return, and that's what is expected to be continued to be tracked through a dashboard.
So I guess, and that leads to my next question. So I was looking at the 2017 goals, and I was struck by goal 2 that talked about expanding access to services, and the strategy 1 underneath that is investing in evidence-based practices that have long-term impacts. And so I'm just, again, wondering why we have to still wait until milestone 1, strategy 1 for 2025 for the landscape analysis at the programmatic level. So can you help me to understand how this level of strategy has been able to be conducted without having that program by program information with change over time outcomes and outputs?
Yeah, so what we were able to do is look at the system level data in aggregate. So it wasn't right. We didn't have to look at it in a programmatic way.
No, I'm sorry. I just want to, I asked if there was a program by program, and you're saying there was an aggregate, so you didn't have to look at the program by program. So thank you. I feel like I got my answer for that. And then just lastly, the funding gaps. I was just curious what criteria you were using for the funding gap analysis work and projections, because there is a gap of 13 million between 2018 and 2030 that remains the same, but the needs and demands go up. So I was just kind of, it kind of made a little flag for me, as I know the different cuts and fiscally restraint and environmental, economic problems and challenges that we're having. So I'm just curious what data points you were using for your modeling to make that projection.
Yeah, so the way the model works is that it defines what is your existing capacity, and then it calculates kind of based on the percentages that we represented for the pathways. It then calculates what's the gap. And then we worked with staff to identify the cost per slot, and that's how it then projects the relative investment today versus the gap in investment needed. And then it has the model over time just uses a really simple kind of inflation, annual inflation, right, figure that. And so
Awesome.
and so the last thing to say is what the model you're looking at in the report represents is over a 5-year period. In the first 3 years, we're going to work to resolve all individuals who are long staying, who have been homeless for more than a year. So they flowed in earlier and they haven't yet to flow out. And we're going to figure out how to start avoiding that in the process. So it's going to cost, you're going to see differences, right? You're going to see a growth in those first 3 years. And then to sustain that system and avoid having long stayers in the future, then it stabilizes. And that's the consistent cost figure.
Thank you. I appreciate these responses. Thank you. That's all I have.
All right. Tara.
I have no questions. This was such a great report. I asked my one question and forgot to take my hand down.
Okay, then I'll call on myself really quickly. One question I had was with the goals, the very high level goals about reducing the time of homelessness and also about reducing rough sleeping. Just from I guess from a city perspective, are those goals that we feel the council needs to adopt, or are those goals that really are being led from the city?
I might take that one, Tina. Mark Wolf, Assistant City Manager. I think we are looking at the strategy as an operational document. So don't anticipate kind of needing any formal adoption. I would say that your feedback tonight, gauging general support for those goals, certainly helps us take that kind of general policy direction forward. And as Nuria mentioned, you'll see some of that reflected in the 2026 budget proposal. So I think generally understanding where council's at would be great, but no, not anticipating a formal action.
Okay, and then similarly with our partners in the county and the city of Longmont, would we want to see if they would also be interested in supporting those as the goals that we're looking to achieve?
Yeah, it's a good question, and happy for others to chime in on this as well. We have been working with them through the process, and certainly they are aware of the strategy. I think we are anticipating bringing the strategy and some of our implementation thoughts back to HSBC as well, since we have heard that the county and Longmont certainly would continue to support that model and allowing that to be staff driven. Certainly anxious to hear how the funding decisions will play out in both of those entities over the next few months as well. And certainly HSBC will be in a position to react to that, and hopefully the strategy can be a guide.
Okay, and then I had some specific questions about the report. The first is that we all were sent conveniently today the point in time count, and they did mention that 76% of the people that are homeless in Boulder have a disabling condition. And we also mentioned that a small percentage have a severe behavior, mental health issue that needs to be addressed in this report. What are the other conditions and how can they be addressed? Because the way it's phrased in the PIT count is that there are conditions that would keep a person from pursuing employment or living stably in housing, or might need some kind of intervention. So what is that delta and how is that being addressed?
I will let Megan answer that. I think she'll provide some good insight to that, and particularly with her work with the individuals with those multiple challenges that they have.
Sure, I think I could speak to what we're doing currently. I don't know if Mandy wants to speak to what the strategy would suggest we might do differently. Currently, those folks are the ones who typically stay in the system longer, and are the ones who get prioritized for the permanent supportive housing that we do have. We have a very small amount of rapid rehousing, and kind of that has decreased in the last year or so, but that would be our secondary option, where we would be trying to match those folks with some of our more intensive. And I do think it primarily lives around the behavioral health and the substance use. Some of the physical disabilities, we're able to get people with some income, SSI, some ability to work, and able to get them into market rate or maybe just a regular HCV voucher.
I think
the
other thing that I would add is it's difficult to draw that kind of conclusion from the point in time count. So the point in time count is a survey that asks if individuals have a disabling condition. That definition of disabling condition under HUD is relatively broad, but it would be a kind of a false correlation to believe that every individual with a disabling condition is in need of a really intense intervention. And actually, systems who are closer to reaching kind of the scale, right, to eliminating unsheltered homelessness altogether, what they've come to understand through the evolution is that many of those individuals, in fact, don't need, right, a deeply intensive and long-term intervention, particularly if we can intervene earlier in their homelessness. So I just caution you to look too deeply into the point in time report. It's honestly not really intended to provide us with those kinds of insights. It's for trend analysis, and particularly for trend analysis relative to the overall kind of number at a point in time, and is a better tool to then compare against inflow to have a relative understanding to the impact of our investments and our strategies.
Okay.
I'll also just mention that, excuse me, sorry. Our other data sources like coordinated entry and our One Home system have better data on those disabilities, and some of it can come in the form of even the length of time that they've been unhoused. That's a disabling condition. So I wouldn't. I agree with Mandy that that's not necessarily the purpose of the point in time count, but those interviews are helpful for us as we look at that. But through the other databases, we're actually spending more time with individuals to get more accurate data on those types of trends. And on our dashboard, you'll be able to see more information around that.
Okay, and then thanks, that's great. And my last question is on the strategy around getting access to more beds in the county and the state. Do we feel that there are things that we haven't pursued yet? I think that there's just so many people working hard to get people connected to resources that that there is still an opportunity there. And we actually even considered it in the Intergovernmental Affairs Committee to ask the state to give priority to communities that have significant sheltering facilities to have some kind of priority over for some of these beds. But are there things that we feel like we can pursue?
I don't know if Nuria has any input on that, but I know that Carl Castillo worked very hard on that, and I know that there's many communities that are leaning into that concern.
I would say, and I appreciate that. I think that there could be. I think we're in a difficult environment right now with the current administration, but I do think that there are opportunities to explore. I'm really hopeful with our new intergovernment affairs officer coming on board to see what that could look like. But both the state has opportunities, and I haven't given up on federal possibilities that are continuing to come down. I know that we as a city are in a better position than perhaps other communities in that regard, and that we don't heavily rely on federal funding. But I do think that there are different ways in which we can think about braiding funding and layering so that we can try to maximize that. I know that there are additional conversations we're having currently, even with things like what is the use of the opioid proceeds and what does that look like as we're thinking about some of the conversations we have here, right? In fact, I'm going to have that conversation tomorrow with the Opioid Council that we can think about leveraging as we continue this conversation. So long-winded way of saying, I think there are opportunities and we're going to have to take those as they come. But again, this is an opportunity to think with our partners about what are ways we can maximize those as opposed to perhaps previous ways in which everybody was kind of doing their own thing and a little bit of peanut buttering some of those opportunities around.
Okay, well, those are all the questions I have. Are there any other clarifying questions before we move on to comments? Okay, Matt.
Just a quick one. I know that this discussion is really, again, come back to sort of centralizing some services and stuff with the day service center, which makes sense. But is there a balancing act with individuals coming to the shelter as compared to when some of our teams who are out in community interacting with individuals and sort of mobile triaging, if you will, for lack of better words? And is there a balance of both so that we can make sure that the most people are entering the system and rapidly being assessed needs and therefore funneled where they need to go? Or is it the physical presence of needing to be at the day service center critical unto itself? And so I'm just sort of curious based on how folks are spread around the community and how maybe that balances.
I'll provide a little bit of input there. So Focused Reentry does a lot of that work currently, and they will continue to be a good partner in that. There's other partners like Feed Forward that also provide that kind of support. I would say, however, that the day service center, the intent and how it's rolled out, there's a collection of 18 different organizations that provide service in the day service center. So while there will continue to be efforts to support people out in the street or along the creek, really they're showing up at the day service center is really going to give them the broad and more comprehensive assistance that they need.
Okay. Thanks, Kurt.
Okay, and maybe our last question will be with Nicole.
Hopefully a good segue into the comments. I was just wondering, staff, if you could remind us what types of comments would be most helpful.
I think it is general feedback on the strategies themselves. Certainly if there's, any type of kind of major gap that you all are seeing, it would be good to capture that. I think our goal is to finalize the document based on your comments. So I think anything that are really directly aimed at the strategies would be most helpful.
Okay, and again, I think you had asked us not to focus as much on the budgeting part, which has some unique challenges, but that we'll do that through the budgeting process. So is that, Kurt, I see your hand is up.
Yeah, if I could just make one more follow-up comment, Tina, to your question. So there's been a lot of conversation about the county behavioral health. And I also just wanted to add in that much of that behavioral health service is actually supported through Medicaid, and actually a significant amount is both primary health care and behavioral health. And as we know, there's risk around that in the future. So we've already seen in the last year that there's been a reduction in the individuals that are covered through Medicaid. So that's something that we're watching, and we'll have to look at as a community to understand how we support Clinica in providing much of the services, as well as other providers that use that as a financial resource to support those individuals.
Okay, thank you for adding that lens to think about this document. So why don't we move on to feedback? And we still have 45 minutes. So I think, this is an important topic. So hopefully we can hear from everyone. So who would like to kick us off? All right, Mark.
I know there's going to be a lot of approval and love reflected for this plan. And I know we've been asked not to focus on budgetary considerations, but I simply do not understand how you can have an action plan without understanding where you're going to fund it. $13 million a year is a lot of money. The assumption that the housing department will grow by 10% a year for the next 5 years, I think is contrary to what almost every department in the city will experience. So that's a concern to me. To me, regarding this as an operational plan in the absence of $1, is very troubling. On the substance of the plan, I think there are just a lot of good things there, and I could provide a little love for those specific proposals. Diversion, I think, is a great program. I think the program for homeless families is terrific. Protection of LGBTQ plus individuals and young people is fabulous, but I simply cannot look at this and say, well, in fact, I was told, quote, that this document provides a roadmap for a fully optimized system and it is independent of current budgets and or economic conditions. I don't accept that. And I don't think you can accept that. That's not good governance to me. I like the plan. I don't like it's being divorced from funding. And if we're going to divert funds from other departments and other reasons to close that gap, I would like to know about that before I finally sign on to it. So I approve of the components and specifics of the plan, but I am very troubled that we're living in, to some extent, to la la land because we don't have dime one. All right, that's my view of it. Thank you.
All right, Tara.
I wonder why there were not a lot of other hands up, but okay. What I love about this plan is probably it's the opposite of what Mark doesn't like, I guess. And that is that it is more of like a blueprint for organizing how we're going to go forth. When it comes to, for instance, any of our transportation ideas, let's just say, we don't have funding for it at the time. And then whether it's through grants or the many great ways that staff gets money to pay for things, at least why this makes me very happy is because it is just like without an overall plan and a road forward, and this is somewhat detailed, although not in the budget area, then we're just constantly reacting to what is currently happening. Or what can we do specifically versus here is our big plan, and that is to get people off the streets and into some sort of shelter or housing and the many different details that it went. So that are available that were also in that plan. So I would say that is what I do like about it. And let me just hold on 1 second. Let me just find that little sheet of paper that tells me something that I can really impress everybody. No, I'm kidding. I don't have anything impressive. I like the key milestones. I'm not usually a person, I like to live for the day. Honestly, I'm not like a future thinking person. So what I like about it, it really pushes me to like say, this is what we want to accomplish in the future. I like the core strategies very much. And then the details, well, we've all been working, some of us older on council for years and years and years, right? Trying to accomplish some of these things. And to me, it just gives us the way forward. So that's why I like it.
Okay, next we have Taisha and then Lauren.
Awesome, thank you very much. So when I first came on council and I had the opportunity to meet with the HHS team and got to see the incredible theory of change and outputs and outcomes and everything. I got like super excited, and I asked for like the programmatic level of detail on just like outcomes of how are they doing, and I was told, wait, we'll get that information, or it's really complicated. There's a lot of partners. Each people have different pieces of the puzzle, and so we're going to compile this together. And I'm still I'm just disappointed that it's still not here. And I just have a hard time, again, as a strategic planner, somebody who's been doing that for 20 years. The idea that these kinds of strategies can be developed without having programmatic data on outcomes and budgets. And I'm not asking you for budget projections. I'm asking you for how much money did we spend on these programs over the last 7 years? Or even 3, or just at least 3. And so again, just coming from my expertise in evaluation and program evaluation in complex organizations, I continue to be concerned about the ways that our research and evaluation is being conducted. And so specifically, not having an equity analysis, please stop saying that we do equity if we are not including an equity analysis at the systemic level when it's possible. You even have equitable elements within the document, within the other components of the analysis. And so I just continue to be eager to get to walk our talk on equity. And equity is not just having people with lived experience in the room. Equity is access, meaningful representation. Equity is in quality and outcomes and outputs. And again, just the accountability mechanisms, I'm just not seeing it. And the data points that we would need to make these kinds of decisions on will we move forward with this strategy or not is very difficult without having that information. The milestones. So again, in my world, a milestone is something that is in service to reaching a goal. And it sounds like in this iteration, a milestone is what we want to achieve in 5 years. So my question becomes, what are the look-fors between years 1 and 5 in order, like what kind of data would you be collecting? Like, I'm just, and if this is an operational plan versus, aligning to the, I thought that there was a real effort to align the operational plan at the staff level with the council goals, with the BVSD plan, et cetera. So again, just that need to weave and crosswalk across plans. I did notice the 2 blurbs in the beginning, but again, I feel like there's an opportunity for some deeper weaving here. And then the partnerships component, really having a better idea, outline, and understanding of what I appreciated Ryan's question around the delineation between the city and the county. But as you indicated in your report, the organizations that are supporting family homelessness are very different than the support organizations that are supporting single homelessness. I also, going back to the equity question, have a lot of questions around family homelessness, as I've only heard us talk about it as a monolith. And I know that there's a lot of variety. Family homelessness looks very different, and the different scenarios can elicit different responses. So are these, is it documented or undocumented? Are there children, how old are the children? Are they in school? Or are they out of school, right? And so again, just having a little bit more information in order to guide this strategy, as opposed to, the efforts that were completed, which are helpful, and the programs that are proposed are, interesting. But I was hopeful that this was an opportunity for us to take a look at where we've been and the outcomes of those efforts over the last 7 years to then inform the strategy and the budget and those kinds of things moving forward. So I say all that to say, I look forward to the programmatic data for outcomes as well as cost, and a proper systems level equity analysis moving forward before I can advocate on anything related to this work. And the idea, again, and I couldn't more wholeheartedly agree with my fellow council member Mark when he says the idea that y'all can create a strategy without one dime of where the stuff is going to come from is some of the challenges that I think, or some of the processes that we need to revisit, because we can't just build it and then try and figure out how we're going to make it work. We really need to meet the moment. And then lastly, and I voiced this in my one-on-one conversation, which is I feel like this plan needs to align with the moment at the federal level as well, knowing that the county is going to continue to experience deficits and cuts that are going to decrease their capacity, which then again has us hitting, at a much higher level than we really have the capacity to meet that need. So I appreciate the effort, and I await qualitative and quantitative data to make the decisions that we need to make at the next stage. Thank you.
All right, next we have Lauren and then Matt.
Thank you. So I hear the concerns of my colleagues, but I also think that this is a bit of a unique issue. It is by far the issue that I hear the most about from our community. And I appreciate that this framing really encourages us to refuse to accept homelessness as an unsolvable tragedy. It really pushes for finding and moving towards a solution. Over the past 2 years, we have seen reductions in unsheltered homelessness, while the nation at large has seen increases. And that didn't happen by chance. It happened because we chose to stay the course with housing-focused solutions and also work hand in hand with our regional partners. I think, I'd like to highlight the eviction prevention and rental assistance program that's kept 96% of the families it serves in their homes. I think that's the example of a program that can really have profound impact, and is relatively inexpensive for us to provide. But we can't rest on what we've already achieved. I think, as I mentioned, homelessness remains by far the greatest concern we hear from the community. So we have to work really hard to close those gaps that remain, to expand rapid rehousing so people spend less time in crisis, to advocate at the state and regional level for access to institutional and behavioral health care so that we're not leaving people untreated in our community, and to create more safe short-term options for people who need them. I also think that it's really important that we invest in and make sure that we're continuing to invest in more invisible forms of homelessness, like family homelessness. As this moves forward, the main things I would really like to see are details, being really explicit about what kind of those changes are and look like. And I know it's hard, but where possible, guidance around trade-offs. As many people have mentioned, our budget is tight, but we have to work towards a day in Boulder where homelessness is rare, brief, and non-reoccurring. And I think that we will find benefits in terms of improvements of quality of life for everyone in our community in a way that we can't through other types of spending. Like, this is such a critical thing for us. And this study shows us, it's not perfect, but that we can get there. We've seen progress. We have built many of the tools we need. And Nuri, I appreciated your comments earlier, but I hope we can find a way to dig deep and continue to make significant progress. Thanks.
Okay, Matt.
Thanks, Tina. Appreciate some of the comments that came before. I just want to maybe respond to one before sort of give my other feedback. We make plans and we set courses for projects all the time without securing all the funding. The Core Arterial Network program is a perfect example. We've been building better streets, better intersections, better bike lanes, all the while still working year after year to secure the funding to finish that build out. So just because we don't have the funding now is, one, not an indictment on the quality of the strategy, and two, it shouldn't prevent us from moving down the path, because we can do a lot with the new strategy with the resources we have. So I'm hopeful that we can continue to do that, and I think staff's charted a good course. I will say that,
I'm sorry, can I have a point of clarification, please?
Sure.
Thank you. I don't know which colleague you were mentioning, but I wasn't suggesting that we needed to have the money secured. I was suggesting that there was no financial data to inform the strategy. So I just wanted to clarify that, if that comment was for me. or my comments. Thank you.
It was not, but thank you for the clarification. So, what's essential here is recognizing the successes that built where we're at, right? We have done a tremendous job doing the housing and exiting people from homelessness. And it's just time that the strategy has to evolve to also work with how people are coming into our community. And I think the time is right for us to do that. And so I think that there's just really tremendous opportunity in front of us for how we think about that. And I thought Lauren made a really great point in terms of in the future, we should be looking at things where people are coming in and one very infrequently and their time is spent very short and they have a rapid exit back into stability, if not a place to thrive. So I think that there's just tremendous opportunity in front of us for that. I like where this strategy is headed in the sense that it's actually looking at some of the constrained resources, but realizing that we have to invest further. I love that it also points to where our role is and where it is not. And I think this has been so much of our pressure, our stress and conflict with the county, which is really trying to understand where whose lines are what. And I do recognize that at a staff level, staff is working great together. It is at the policy level that this is a major breakdown. Again, our two entities are quite different. We have a city manager run organization at the city of Boulder, and the county has a political arm that runs the county, and that is fundamentally different. And because of that, there is tension, and that tension needs to be resolved. And so I just like that it points to that, and I think that that's a great place to sort of try to build partnership with the county and hopefully get them to see that this is a strategy that could be scaled up and perhaps utilized in whole or in large portion with what may become a regional strategy. I'm still waiting to find that regional strategy, but hopefully with some pressure and some showing good results here in the city that we can show the county that they can take these things, scale it up, and not have the risk of doing things in the unknown, and have those outcomes that they can then scale and take responsibility for as our regional agency going forward. So anyway, I really appreciate where this is taking us and hopeful that staff can do a great job in executing it. And when more money comes online, scale it up. But really appreciate where we're headed. And Mandy, thank you for spending so much time in our community to help us out. Appreciate that.
Okay, Ryan.
Megan, Elizabeth, Kurt, and team, thank you. There's a long list of unsung heroes in the city who get a lot more opinions than they do thanks. And you all are high on that list. And I'd like to just say thank you for your service to this crucial work. And also Mandy, yeah, this is a solid body of work. And also Councilmember Folkerts, thank you for your work in and around this and our county efforts. So I generally do have a lot of confidence in the team's expertise and work here. And I just have I think 3 kind of practical suggestions. So the first is picking up on Mark's concerns and Tara's commentary. I do agree that it's good to have a visionary plan that starts with not being hemmed in by financial constraints. And I do hope that when we get to the point of having to do budgeting, that we will get recommendations from staff and not find council in a position of somehow having to sort of figure this out. So maybe I'm trying to draw a bridge between those 2 comments that we do need the advice on how to do the budgeting. So I'll look forward to that. Second one, I asked what was new, and Kurt, you and the team provided a list. I think if I also follow this correctly, there was also something new that's a plan to consolidate outreach services that would reduce what we currently have in Central Park. I guess I would just say, whether I have that exactly correct or not, in any case, I would just encourage that as we go forward with changes, that we be very thoughtful about where we are making changes, and that we set up a good way to track the outcomes coming from that, and then have a way to come back and compare and check up, with what's working against the baseline. And then third, I heard on one of my earlier questions about the county versus city work. I heard a kind of very heavy emphasis in partnership, And it makes sense that that is, you know, the I guess the kind of theme. But I do think as we go forward and think about future reporting and dialogue about what we're accomplishing, I do think it would be helpful to have a little more breakout of where the organizations have their unique roles and responsibilities so that we're able to understand what the organizations are bringing to the partnership, and just able to, I guess, appraise that a little bit more. So I know that's all there, and just look forward, yeah, to the next time we talk about it to be able to dig into that a little more. Thank you.
Okay, Nicole.
Thank you. And just, I so appreciate all the work that everybody has put into this. A couple of things that just comments I'm taking away. One is that we've got different strategies for individuals and families. I love that. When I first started on council, we as a council didn't really even talk about family homelessness much. And now we've got a whole separate strategy for it. And to me, that reflects a pretty major advancement. And I just want to note that. I think, you know, clearly there's more work to be done in terms of just getting information across all the different people who are engaging in family homelessness. But the fact that we're talking about it and have a plan it is, to me, quite remarkable. So thank you for that. I love that we now have a clear picture of where we want to go that's updated for 2025 and beyond. I, like my colleagues, am wondering about the funding and all of that as well. And I know we'll continue to have those conversations. But I think a lot of the really wonderful things about the city have come just from having a really good plan to start with, like the Boulder Valley Comp Plan, our flood and stormwater master plan, which is still one of my favorites, all of that. So I'm just really excited that we have this update in place now too. And then the other thing that I think is going to be interesting as we move forward into future conversations is thinking about the different potential paths and timelines that we could take, because this was certainly a very ambitious one that, you know, if we could get the funding to implement everything, we could be looking at getting basically to functional zero within a few years. And just thinking about what are the different steps along the way that will get us to those different places. What's the focus on prevention versus responding to acute homelessness or chronic homelessness, especially with more and more folks likely falling into economic precarity as we continue to lose jobs and things like that. How are we going to think about that balance between prevention and response to a situation that's already unfolding? So I look forward to having those future conversations, but I'm really thrilled with this plan that we have in front of us and look forward to helping to implement that as at least the first stages as we head into budgeting this fall. Thank you again for good work.
All right, Aaron.
Great. Well, I will add my thanks to my colleagues for the amazing and extraordinary work. As I said earlier, Mandy, thanks so much for coming to our community and putting all of these great recommendations in front of us. And to our internal team, Kurt and everybody, just appreciate you so much. And I think we're absolutely on the right track with this plan. There have been a great set of comments by some of my colleagues. I'm tempted to just say ditto what Lauren said, because Lauren, I thought your comments were perfect. I'll just add a couple more things. Also appreciated Matt's recognition that we don't always have the funding for the plans as we adopt them, and the CAN is a great example for one that we adopted a few years ago and then have been implementing as we have funding available and resources. So I think it's ambitious and appropriately so. I appreciate, Matt, you asked a question earlier about just in terms of prioritization around funding and what resources are available to what people. And so I appreciate the recognition that we can't provide every service to every person much as we wish that we could. And so I appreciate that the plan recognizes that we have to do some form of prioritization in order to get to that functional zero level, which, you know, with this plan, it does give us a vision of that. So I look forward to us continuing to get the numbers of people sleeping rough down and getting more people into the stable housing that they need. So thanks again, everybody, and looking forward to the next steps.
Thank you. And I'll call myself last. I agree with a lot of the comments that have been said. I am particularly appreciative of the 2 goals for individual adults and the goal for family housing and the way that those have been simplified. And one of the things I would look forward to is to continue to have just reporting on those goals specifically, because I just will want to see the progress we make, depending on, of course, the money that comes in. I think one of the disappointments with the budget is that this is such an important goal or value of our community, is to help people who are experiencing homelessness. And it's frustrating to have a plan that looks feasible and know that we don't have the money to make it happen. So it is very frustrating, and I hope that, and I look forward to staff understanding where we can make the biggest impact in the shortest time to meet the goals that are put forth in this plan. So the other piece is I would like to see in this plan, or in any work we're doing on this topic, how we can continue to clarify the roles of the city and the county and make more progress there, including on how we align with our nonprofits and with our budgets. I think we can continue to do that, and we have some great partners. And then I also just want to hope that our nonprofits are heavily engaged, particularly All Roads, which seems to be the center of a lot of this work, and they're doing so much work already. So as we think about the new work and how they can be supported to take on even more of the city's responsibility as we try to make these changes. So that's all I have. Staff, is there anything else you wanted to add before we close out for the evening? And was this helpful? Is this what you need?
Yeah, I'll just share my appreciation for all of the input from all the various different perspectives. They all are helpful in understanding how we will measure this and report it to you, how we will prioritize funding in the future with you. And I'm also actually looking forward to working with our other partners in the county in Longmont and seeing in ways which we can align with this strategy. And I think the last thing I'll say is, and you've touched on it a little bit, the real heroes in this work are the organizations that are working with these individuals every day. It's not necessarily us as staff of the city of Boulder. And just really want to show indicate my appreciation. They're compassionate, caring people who are actually incredibly skilled at what they do. And I think the combination of that with the resources that we've had has really led to the success that we've seen. And we're really looking forward to growing that with this plan and with this roadmap as resources become available. And if I reflect on where we've come from 2017, I think there was a lot of concern in the community at that point. I feel like there's been a lot more alignment since then. And I think this strategy will help you move that further. So thank you.
Thanks. Mark, I saw you come off mute. Did you want to add anything?
Kurt covered it well. I think appreciation for council tonight and your engagement throughout. Also to our staff and Mandy for spending many hours with our service providers and our staff and really providing such excellent expertise and guidance throughout the process. So just wanted to also extend our thanks to her and just appreciative that we're feeling in good shape and having a roadmap for the future. So thanks council for all your comments and work on the lead up to producing this document.
I just wanted to add, and I appreciate Kurt, you lifting up everyone who's doing this really hard work on the ground. But Mark, you touched on something, and council, I say this earnestly, hard conversations because it's hard work, and you're a real important part of this, right? Your advocacy as we're thinking about how do we continue to work with our partners at the elected level, at the state level, at the federal level. We need your help as we push this forward. Certainly there's a lot happening on the ground. Certainly there's a lot of work that we are doing operationally and with our partners, but your voice and your support in this, your advocacy role will be critical as we continue to do this role. And so we thank you so much for leaning in, because the work of regional partnership requires your voice to move this forward as we're thinking about leveraging partnerships, leveraging money, leveraging funding, leveraging that layering. And so I just want to highlight that this takes all of our efforts to move it forward, and thank you all for leaning into that.
All right, well, I think that's it. We're about 15 minutes shy of our end time of 9 p.m., but I hope that we can say goodbye and take back those 15 minutes. So we'll conclude this meeting at 8:44. Have a good evening.
Good job, Tina. Great job.